Hey everyone, welcome to our deep dive all about intravenous fosfomycin.
Intravenous fosfomycin, that's
Now,
right.
this one is going to be particularly relevant to all you medical microbiologists out there.
Absolutely.
And don't worry, we're not going to bore you with the basics. We're going to jump right into some of the really interesting stuff from the World Health Organization's Aware Book, Chapter 44.
Definitely.
It's all about fosfomycin as a reserve antibiotic.
Right.
So let's get started. What exactly is fosfomycin?
Well, it's a phosphonic antibiotic, actually. It was discovered back in the late 1960s.
Oh, wow. So it's been around for a while then.
Yeah.
And unlike a lot of other antibiotics, it targets this enzyme, pyruvyl transferase, which is super important for bacterial cell wall synthesis.
Right.
So this unique mechanism is a big reason why it's a reserve antibiotic.
Yeah, exactly. It's kind of like our secret weapon for those really tough, multi-drug resistant infections.
The really challenging ones.
Yeah, where other options have just failed.
Yeah, so it's last resort, but a powerful one. The Aware book doesn't really go into too much detail about the clinical presentation, though. So I'm curious, in what kind of situations would you, as a microbiologist, think about recommending fosfomycin?
You know, those really dire scenarios where you've got these severe infections and those conventional antibiotics just aren't working.
Oh, I see.
So think like sepsis, complicated urinary tract infections, even bone and joint infections.
Oh, wow.
And we're talking about infections caused by some pretty nasty pathogens here. You know, those multi-drug resistant ones?
Yeah.
Like carbapenem-resistant Enterobacteriaceae or even MRSA.
So when nothing else is working.
Pretty much.
Yeah.
Fosfomycin could be a real game changer in those situations.
Okay, so that makes sense. It's like our secret weapon we keep in our back pocket for when things get really bad. Now, the Aware book talks about fosfomycin's spectrum of activity, and it's pretty impressive. It goes after some pretty tough bacteria like MRSA and VRE. It even tackles those ESBL-producing Enterobacterales.
Yeah, it is. It's active against a really wide range of gram-positive and gram-negative bacteria, including those tough ones you mentioned.
But I'm guessing it's not a universal solution.
Right. It's important to remember that its activity against some of those carbapenem-resistant bacteria, especially Pseudomonas aeruginosa, is a little iffy.
Pseudomonas always got to be different.
Yeah, pretty much.
So let's say a sample comes into your lab. How do you know if fosfomycin is the right way to go?
Well, as microbiologists, that's where we come in.
Right.
We use all sorts of lab tests to help guide those treatment decisions. You know, standard culture and sensitivity testing is essential to see if those bacteria are even susceptible to fosfomycin in the first place.
Makes sense.
But we can also use molecular techniques like PCR to pinpoint specific resistance mechanisms, which gives us an even better understanding of what we're dealing with.
So it's really about putting all those pieces of the puzzle together. Now, are there any other lab tests, besides the microbiology ones, that you'd consider when thinking about fosfomycin?
Oh, for sure. We have to think about the whole patient,
Okay.
you know, and the potential side effects of intravenous fosfomycin, like their overall health.
Of course.
Especially their renal function.
Okay, I see.
That's super important.
Because of the way that fosfomycin is cleared.
Exactly. Dosage adjustments are needed for patients with kidney problems.
Yeah.
So we'll be checking their serum creatinine
Right.
and sometimes even their creatinine clearance.
Oh, wow.
Electrolytes are also important because fosfomycin can sometimes lead to low potassium levels.
Hypokalemia.
Yes, hypokalemia,
Yeah.
and of course, a complete blood count.
Just to get a sense of their overall health.
Exactly.
So it's really a holistic approach.
It is.
Now, what about imaging? The Aware book doesn't really talk much about imaging, but I would think it plays a role, right?
Oh, for sure.
Yeah?
Imaging is super important for figuring out how bad the infection is and where it's located.
Yeah.
So, you know, we might use x-rays for suspected pneumonia or bone infections. CT scans are helpful for those intra-abdominal infections.
Right.
And sometimes we even need MRIs for those really complicated cases.
Oh, like a brain abscess.
Yeah, exactly.
Like you're using all these different pieces of information
We are.
to really get the full picture.
Yep.
Now, the Aware book really stresses the importance of using fosfomycin in combination therapy. Why is that?
Well, combination therapy is super important for minimizing resistance, especially with a valuable antibiotic like fosfomycin.
Right.
When we use multiple antibiotics that target different parts of the bacteria, it's like throwing a 1-2 punch.
Makes it much harder for the bacteria to fight back.
Exactly. They have a much harder time adapting and developing resistance.
Okay, that makes sense. So let's get into the specifics of intravenous fosfomycin dosing. Table 44.2 in the Aware book gives us some recommendations.
It does.
What are we looking at here?
Well, for adults with normal kidneys, the typical dose is 6 grams of intravenous fosfomycin, given every 8 hours.
Now, that's a pretty big dose.
Yeah.
What about for kids? Is it based on weight?
It is. For children, we recommend 200 to 400 milligrams per kilogram of body weight per day, divided every 8 to 12 hours. And again, it's given intravenously.
Wow, so those are some carefully calculated dosages. Are those just general guidelines or?
They are general. It's really important to check your local guidelines and talk to experts.
Okay.
Because things like the severity of the infection and the patient's own situation, especially their kidney function, can really affect the dosage.
Right, it's not one size fits all. Now, before we move on, I want to go back to fosfomycin's mechanism of action for a sec. We talked about it earlier, but it's worth repeating.
Yeah, it's pretty unique. It inhibits bacterial cell wall synthesis by targeting that enzyme, pyruvyl transferase.
Right.
That's why it's so effective against so many different types of bacteria. But it also means we have to be extra careful about resistance.
Speaking of resistance, the Aware book has a whole section on emerging resistance in Enterobacterales, and it's a little concerning. Are we already seeing fosfomycin losing its effectiveness against some of these superbugs?
Sadly, yes. We are seeing increasing resistance, especially in Enterobacterales. It's definitely a worrying trend.
So even with our reserve antibiotics, we're still in this race against resistance. Now let's go back to table 44.1. Which pathogens are most likely to be susceptible to fosfomycin right now? That's where your expertise really comes in.
Well, that's a good question, but we have to be careful about making generalizations because the epidemiology of resistance is constantly changing. What we see in our labs today might be different tomorrow.
So it's about staying informed and adapting our strategies as we go.
Yeah.
Okay, well, this has been a great start to our deep dive into intravenous fosfomycin. We've covered a lot of ground, from its unique mechanism of action to the challenges of antimicrobial resistance. But we're just getting started. Join us in part 2 as we explore the complexities of antimicrobial resistance and the importance of responsible fosfomycin use.
It's going to be great. Welcome back to our deep dive on fosfomycin. We're going to keep talking about this unique antibiotic.
All right, so we left off talking about these emerging resistance patterns, which brings us to this broader issue of antimicrobial resistance. It's complex, but can you give our listeners a quick rundown?
Basically, antimicrobial resistance means that microorganisms figure out ways to avoid those drugs that used to work against them.
Yeah.
It's a natural thing, but we've kind of sped it up by overusing and misusing antibiotics.
Both in humans and animals.
Exactly.
So what happens when these antibiotics we've relied on stop working?
Well, that's a problem, right?
Yeah.
It means that resistant infections can lead to longer hospital stays, more healthcare costs, and even higher death rates.
Wow.
It's a big deal. A global health threat. We've got to pay attention to this.
Okay, so how does fosfomycin play into all of this?
So it's a reserve antibiotic.
Right.
Right. Which means we're trying to save it.
Keep it for when we really need it.
Right. For those really severe multi-drug resistant infections that we talked about, if we're careful, we can slow down that resistance development.
Okay. But we also mentioned that resistance to fosfomycin is already increasing, especially among Enterobacterales.
Yeah.
Is it even possible to win this battle?
It's a challenge, but we can definitely make a difference.
How?
Well, as microbiologists, we're really important in all of this. We need to be really careful with our testing and reporting of fosfomycin susceptibility. Accurate data is key for those treatment decisions.
So making sure those test results are reliable and getting them out there quickly. What about outside of the lab? What else can we do to make sure we're using fosfomycin responsibly?
We've got to work together with clinicians.
Okay.
Make sure fosfomycin is only prescribed when it's really needed.
Not just throwing it at every infection.
Exactly.
Let's talk about some of the practical stuff. What are some of the challenges you face as a microbiologist when you're trying to make those fosfomycin treatment decisions?
Well, like we said before, fosfomycin's activity against certain pathogens can be a bit unpredictable.
Pseudomonas aeruginosa.
Yeah, Pseudomonas aeruginosa. It's tough to know if it's going to work in every case.
So how do you make those tough calls? What do you look at?
You have to consider everything.
Okay.
The patient's history, the infection site, how sick they are, and those local resistance patterns from our labs.
Right.
It's a balancing act.
You're weighing the pros and cons.
Exactly.
What other hurdles are there with fosfomycin?
Well, giving it intravenously can be a bit tricky sometimes.
Logistically.
Yeah. And there's that risk of sodium overload and low potassium.
especially for those patients with heart or kidney problems.
Right, so monitoring is really important.
Again, it's about looking at the whole patient.
It is.
But even with these challenges, fosfomycin can still be really effective.
Oh, absolutely.
Yeah.
When it's used the right way, it can literally save lives.
Those patients battling those multi-drug resistant infections
Exactly. It's a real beacon of hope for them.
when nothing else is working. Can you give us some examples of when fosfomycin would be best choice?
Sure. The Aware book talks about its use in severe infections caused by carbapenem-resistant Enterobacterales, especially when there aren't many other options. It also mentions using it for tough Staphylococcus aureus infections, including MRSA.
So when other antibiotics aren't cutting it, are there other infections that fosfomycin might be good for?
Maybe. People are looking into its potential for things like bone and joint infections, pneumonia, even meningitis. But we need more research to be sure.
So lots to explore there. What's coming up in the world of fosfomycin that our listeners should know about? Any exciting new stuff?
Oh, yeah. People are working on new fosfomycin derivatives, ones that are even better at fighting those resistant bacteria. And they're looking at new drug combos that could make it even more effective.
Wow. So always trying to stay one step ahead.
Always.
Any last thoughts before we move on?
I think it's really important for microbiologists to keep up with the latest research.
Of course.
And guidelines on fosfomycin use. Things are changing all the time.
Yeah.
And we need to be in the know.
Knowledge is power. Well, this has been great. We've talked about how complex antimicrobial resistance is and how important it is to use fosfomycin responsibly. Get ready for part 3. We're going to get into the ethics of using reserve antibiotics and what this all means for public health. All right, welcome back to our final part of this deep dive, all about intravenous fosfomycin. We've talked about how it works, its use in the clinic, those antimicrobial resistance challenges, and where it fits in as a treatment option. Now let's zoom out a little.
Sounds good.
We've been calling fosfomycin a reserve antibiotic.
Right.
And well, I think that brings up some important questions about public health. So what are some of those public health things we need to consider when we're dealing with a powerful antibiotic, but one that we're trying to use sparingly?
Well, antibiotic stewardship is a big one.
Yeah, we've mentioned that a few times.
It's really about using antibiotics wisely, making sure they keep working for as long as possible.
And when it comes to fosfomycin, what does that look like?
It's a team effort. Clinicians have to think carefully about whether fosfomycin is the best choice for each patient.
Right.
Make sure they're getting the right dose for the right amount of time. And we've got to educate patients about finishing their entire course of antibiotics.
But it's not just about prescribing the drug.
No, it's about making sure it's used the right way.
Okay, what about those bigger picture stewardship efforts?
Those are essential too. We need solid surveillance programs to track resistance.
To see how those patterns are changing.
Exactly. And evidence-based guidelines for using fosfomycin. Plus, we need more research into new antibiotics and other treatment options.
So, a lot of moving parts. It sounds like it's a shared responsibility, making sure this valuable antibiotic isn't wasted.
Absolutely.
We've talked a lot about the challenges of antimicrobial resistance. Are there any positive things happening? Any good news on the horizon?
There is. People are finally starting to realize how big of a threat antimicrobial resistance is. Governments, healthcare organizations, even the general public are waking up to the issue.
So we're all on the same page now.
It's getting there, and that awareness is leading to action. More money is being invested in research and development of new antibiotics.
Okay.
And there are more initiatives to promote antibiotic stewardship and prevent infections in the first place.
That's great to hear. What about the research? Any cool breakthroughs or new approaches that are giving you hope?
Oh, yeah. People are looking into all sorts of new things.
Like what?
Well, they're searching for new targets for antibiotics, developing better ways to deliver drugs. They're even exploring phage therapy as a completely different way to fight bacteria.
Phage therapy? That sounds pretty sci-fi. What is that?
So, phages are viruses that attack bacteria. And we can actually engineer them to kill specific harmful bacteria without hurting our own cells.
Wow, so it's like a targeted strike.
Exactly. It could totally change how we treat infections.
Okay, well, that's pretty amazing. Before we finish up, I want to touch on something that's really important. The role of the microbiologist.
Couldn't agree more. Microbiologists are key players in this fight against antimicrobial resistance.
We are. We're the ones who figure out which bugs are resistant, track how they're spreading, and provide that critical information to guide treatment.
That's true.
We're like the microbial detectives. solving those infectious disease puzzles.
That's a great way to put it. And it's not just about working in the lab.
Right.
We need to advocate for responsible antibiotic use.
To everyone, from our colleagues to the public.
Exactly. Educate people about the issues and collaborate on research and development efforts.
Okay, so a lot on our plates.
We do, but it's all part of protecting public health.
Well, that wraps up our deep dive into intravenous fosfomycin. We've learned a lot about the science, how it's used in practice, the tough stuff, and the hope we have for this incredible antibiotic.
I agree. I hope everyone listening has a better understanding of how important fosfomycin is in our fight against antimicrobial resistance.
And to all you microbiologists out there, your work matters. Keep learning, stay up to date, and keep fighting the good fight to make sure antibiotics keep working for everyone. Thanks for joining us for this deep dive.